My name is Josh Jacobs. I'm an adult reconstructive orthopedic surgeon, and I have worked at Rush nearly my entire professional career. And my particular specialty is dealing with the biological consequences of debris from implants. I have an undergraduate degree in material science and engineering. I've learned a lot over the years about wear, corrosion, and the degradation products generated from those processes. So I've become a referral source for patients who are concerned that they may have a metal allergy or an adverse local tissue reaction to metal debris from corrosion at the head-neck junction or other modular junctions. Therefore, metal allergy is a particular interest of mine, both clinically and research-wise. On the research front, I've collaborated with Drs. Halab and Caicedo and Semelko over the years, trying to understand in greater detail the immunological response to implant debris. That's been quite a challenge. I think we've made some great strides, but we have a long way to go before we fully understand this complex topic.
Do you consider potential metal sensitization an important issue to discuss pre- or post-operatively with your patients?
As I mentioned before, the immunological reaction to implant debris is critical in terms of the performance and survivorship of the implants that we choose. I find that many patients are quite concerned about the relationship between metal allergy and the performance of their implant. I have seen a number of patients over the years that have known contact dermatitis or skin sensitivity to what I call costume jewelry, and they are quite concerned that those reactions that they experience on the skin, for example, if they wear earrings or a watch, may somehow predict that they may have a similar reaction, although in the deep tissues around the implant. So I do think this is a very clinically relevant issue and something that I will have a conversation with patients about, particularly if they express an interest or if they have a self-reported history of a metal allergy.
How has Orthopedic Analysis Metal-LTT testing helped patient outcomes in your practice?
Many patients are quite concerned that they will not have a good outcome if they have a history of metal allergy and the metals that they're allergic to are implanted. Where I have found the LTT testing by Orthopedic Analysis most helpful is in the preoperative setting when a patient comes in with concerns for metal allergy, either based on a history of contact dermatitis when wearing costume jewelry, or just a general concern where they have specific questions about whether or not they're allergic to their implants. So I will order the test and tend to use it as a data point to help decision-making, a shared decision-making process with the patient. There's not a perfect correlation between the outcome of any allergy testing, whether it's patch testing, LTT testing, or any of the other variants of those, but it is a helpful data point for which to come to a decision about which implants to choose with the patient.
Which patients should consider metal sensitivity testing?
I generally order these tests pre-operatively in a patient who comes in with a history of metal sensitivity or a concern about metal sensitivity. This tends to be more common in women, and so I will have a low threshold to order the test to provide me and the patient with additional information to select the appropriate implants. The challenge that may come is if there have multiple metal allergies by this testing, insofar as sometimes there are no commercially available implants that are free of the metal that they are allergic to if there's multiple metals. So that becomes a much more detailed conversation with the patient about the risks and benefits of proceeding with a joint arthroplasty. Generally speaking, metal allergy causing implant failure is not common, but it needs to be discussed with patients so that they understand what we know about this area and the best things that we know of how to diagnose it and prevent it.